Hello, I am Dr. Jayachandra, Senior Interventional Pulmonologist and Clinical Director in Care Banjara Hospitals, Hyderabad. I've been asked this question, does pneumonia lower your oxygen level? It is a very qualified answer, let me tell you. Lungs are the ones which deliver oxygen from the atmosphere into the blood. If they are working normally, they have enough capacity to do that very efficiently. Most cases, even if about 30 to 40% of the lung is involved with pneumonia, oxygenation does not suffer. But if a large part of the lung is involved with pneumonia, yes, the oxygen levels could drop down. This is a very clear thing that we do measure the saturation, oxygen saturation, any person who comes with pneumonia, and we need to do that. But then having said that, it is a very small percentage of patients who do require to be given oxygen because the oxygen level is coming down because of pneumonia. The other thing that we need to look into is pneumonia is fairly common in people who are already sick. So, people whose lungs are already compromised because of either bronchitis, maybe because of some other disease like past tuberculosis, something like that. Over and above that, when they get pneumonia, even if it is minimal, that may aggravate the pre-existing condition. So, even with minimal degree of lung involvement, the oxygen level could come down. So, this is how we are going to look at. If a healthy patient gets pneumonia, in most cases you do not require to give oxygen or they may not require oxygen. But a person who is already sick gets pneumonia may definitely require oxygen support. So, the circumstances or the instances in which the disease has occurred play an important role whether the patient requires oxygen or not. Thank you.